This is Samuel George, consultant plastic surgeon, and we'll be talking about what to do after you have your carpal tunnel surgery to get the best outcome. Soon after the operation, you'd have a 3 cm scar with an absorbent layer to absorb blood, and then an inner adhesive dressing. On top of this, you'd have some gauze for support, surrounded with some wool and a great bulky bandage around that. Now, this bandage that you have on will allow movement in your fingers. This will allow you to get the best outcome day 1 by performing your post-operative hand therapy. Now, your carpal tunnel consists of your median nerve, which we release, along with 9 tendons in the carpal tunnel. This is surrounded by your wrist bones and your carpal ligament, which is the ligament that we divide when we do the release. Now, in order to move these tendons so they don't stick to the median nerve, you need to move your thumb, flexion first 10 times, your index finger to flex the other FDP tendon, do this 10 times as well, your middle finger to flex the third tendon 10 times, ring finger, and this is flexing the tip joint 10 times, and your little finger, and that's 5 tendons we've done with 4 more to go. Now we go back to the index finger, and this time we're flexing the middle joint, so the FDS tendon. Do this 10 times. Now when we do these exercises for the middle joint, we need to hold all the other fingers back so that we only flex this tendon and we don't flex the FDP tendon, because we want to ensure that the tendons are gliding independent of each other to prevent any sticking. And we do that as well for the little finger, and that's all 9 tendons surrounding the median nerve. We then perform this composite movement to ensure our knuckles are flexing and extending. The next movement is a composite opposition. So we use the thumb to perform a tip-to-tip pinch, opposing the thumb to the index finger, the middle finger, the ring finger, and the little finger. And when you reach the little finger, try to come down the little finger as far as you can, as shown in the video. We then want to perform very gentle wrist flexion and extension, and this ensures the median nerve is gliding, again independent to the flexor tendons. We do a side-to-side ulnar and radial deviation as well, so just as in the video, this also ensures the nerve is gliding. Now remember to repeat all exercises 3 times a day, right from day 1, and do this for 4 weeks at least. Now on day 3, can remove the outer dressing, the crepe, the bandage, the gauze, leave just the inner dressings on, and continue all the exercises as before 3 times a day. You will have less restriction as the bulky bandage is off. You'll be able to do more of the exercises, including the thumb pinch opposition, and you can go further down the little finger. This time as well, just make a very gentle full fist and do this 5 times a day. Do this from day 5. Also do a bit more wrist flexion and extension, and hold the extremes of flexion and extension for 5 seconds if you can. And also this is at day 5. Now at day 7, remove the inner dressing and clean the wound and replace an inner dressing. What you then can start to do from day 7 is gentle strengthening exercises. You can use a stress ball, or if you don't have a stress ball, you can just use a rolled up sock, like in the video, and squeeze the sock. Return for removal of stitches in 2 weeks and a wound check. And after 3 weeks, if all is well, you can start quite firm scar massage. And remember to do this with a deep massage, moving the collagen underneath the skin. You want to avoid rubbing the skin like this, as this will just cause irritation to the wound. What you want to do is a deep circular massage, ensuring that the deeper scar and collagen is being moved around and breaking up. This will ensure that your scar heals and settles down properly. Thank you.